Welcome to the Recovery to Practice Virtual Grand Rounds, clinical decision support for providers serving persons with serious mental illness. On behalf of the Substance Abuse and Mental Health Services Administration, we'd like to welcome you. This webinar series is hosted by SAMHSA's Recovery to Practice initiative. The overarching goal is to improve the knowledge and skill of the behavioral workforce and transform concepts of recovery-oriented practice into guidelines and clinical interventions. This series features 6 short mini-webinars built around a composite case scenario to illustrate how to provide recovery-oriented services to people with co-occurring mental health and substance abuse conditions, and to develop a system that is recovery-oriented. This webinar series will illustrate a series of 6 core principles of recovery-oriented treatment for individuals with co-occurring mental health and substance abuse conditions. Complexity is an expectation. Service partnerships are empathetic, hopeful, integrated, and strength-based. All people with complex issues are not the same. For people with complexity, all co-occurring conditions are primary. Parallel process of hopeful progress for multiple conditions. Adequately supported, adequately rewarded, skills-based learning for each condition. The material in this series is organized into 2 courses with 3 modules each, or can be viewed individually. Supplemental resources are available for each webinar. You can also access information on how to receive CMEs for your participation in these courses. The first course contains the following 3 webinars: Becoming familiar with the principles of recovery-oriented care, conducting an integrated strengths-based assessment, and addressing psychopharmacology and other medication-based decisions. The second course contains these 3 topics: increasing participation and activation through engagement and cultural competency, utilizing stage-based interventions and peer support, and maintaining recovery over time and challenges. This webinar series is presented by a team of national experts in the field of recovery-oriented approaches to treatment and services for people with serious mental illness and co-occurring disorders. You can find more biographical information about these presenters as it's available in the supplemental materials for this course. Now it's time to meet Nick. He is a fictitious individual with a story we can learn from. You can download a copy of Nick's story from the supplemental materials, as it may be helpful to have on hand while you participate in the webinars. Nick is a 32-year-old man, a father, a naturalized U.S. citizen, and a Christian. He has been referred to you for treatment for depression and substance use. Nick has many challenges, but also many strengths. We will use Nick's story to help you understand how to approach individuals using services from a recovery-oriented standpoint. Nick M. is Brazilian, who immigrated to the U.S. when he was 18 years old to further his education. Nick has become a naturalized U.S. citizen. His parents and siblings continue to live in Rio de Janeiro, Brazil. Nick was married at 22 and is recently divorced. His wife states that during their marriage, he often came home drunk and was verbally abusive to her. He has 2 young children, a 10-year-old daughter and an 8-year-old son, who live with his ex-wife 40 minutes away. He currently lives in a single room in a residential hotel. He says he loves his children and periodically takes the bus to visit them. He has no other immediate or extended family that lives nearby. Although Nick describes his primary support as the members of his church, he spends a great deal of his time by himself and describes his life as a bit lonely. He is Roman Catholic by faith and attends services regularly. Nick is currently unemployed and on public assistance, but he wants to find work to provide for his children. Before he was on public assistance, he worked sporadically doing off-the-books jobs. Nick started drinking when he was a young teenager living in Brazil. Recently, Nick was admitted to a detox unit from the emergency department in a general hospital after a period of heavy drinking. This was Nick's second admission to a detox unit. His initial admission was 3 years ago. However, he did not follow through on a referral to an outpatient addiction treatment program. With his last discharge from the detox unit, he agreed to be hospitalized due to his severe depression. He was observed to be withdrawn, with little energy, and had trouble concentrating. He had suicidal thoughts, but no real plan to harm himself. According to hospital records, he had become increasingly depressed following a relapse. Nick denies ever having using drugs and began drinking alcohol heavily 6 years ago. Since then, he has had several alcohol-related problems, including an arrest for disorderly conduct. He experienced depressive episodes within 1 year after immigrating to the U.S., shortly after his daughter was born, and with his recent admission. He has been prescribed antidepressants in the past, but stopped them because he did not like the side effects. He also stopped attending his outpatient appointments because he was looking for work. Nick has been diagnosed with severe alcohol use disorder, relapse, and major depression. Upon his discharge from the hospital, he was referred to your mental health clinic for treatment. He is not currently receiving any mental health services or substance abuse treatment. Early in your first visit with Nick, he states, "Well, here I am. Where do we go from here? I mean, I'm not going to feel like this for the rest of my life, am I?" Nick has a great deal going on in his life. Mental health concerns and substance abuse problems that are seriously impacting his life, work, and his relationships and his willingness to engage in treatment and services. How can a clinician or a prescriber draw from recovery-oriented principles and practices to best help Nick? The 6 modules of this RTP virtual Grand Rounds will help us learn from Nick and his situation. So, what do we mean by recovery or recovery-oriented? In 2011, SAMHSA released a working definition of recovery and a set of guiding principles that incorporate aspects of recovery from both substance use and mental health. These 10 components of recovery, along with these 4 major dimensions that support a life in recovery, help to form a structure and foundation for developing recovery-oriented lives and building recovery-oriented systems and services. To learn more about Recovery to Practice, you can subscribe to our quarterly newsletter by emailing rtp@ahpnet.com or visit the SAMHSA RTP website.